Welcome to the show, you guys. Thank you so much for being a guest.
Thank you
for having us.
Awesome. So we're just going to get right into it. And what are you guys doing to nourish yourselves right now?
Ooh, Mara, how about you?
Oh my gosh. I'd probably have a list that's too long, but I like to stick with the things that are simple and consistent on a daily basis. So sleep is a priority, water intake, doing my vitamins. I recently started an endeavor with a personal trainer. So lots of growth in that department. Consistent growth.
Yeah,
Awesome.
let's see. I'm not so good with the sleep or the water, but I will say about 4 years ago, I started doing like very regimented daily supplementing, which is something I've just kind of been, not doing my entire life. And it's been an incredibly positive impact for my health. And like, I literally haven't been sick in 4 years,
Wow.
and I run a pretty high octane lifestyle. Our practice has just exploded in the last 3 to 4 years. I've got 2 kids that keep me really busy. There's a lot going on, but it's been really helpful. So I appreciate that.
Yeah, especially if you're not sleeping or drinking water.
Right. You gotta make up for it.
Well, there's some water in the cold brew coffee, so a little bit of that.
It counts. Now, what are some of your favorite supplements?
Well,
that's such a good question.
Yeah, oh my goodness. So, I mean, I've been doing more of a multi approach with like nano-sized, like powdery stuff. I'm trying to think of the name of it.
Oh, LifePak Nano.
Yeah, I've been using the LifePak Nano stuff for the last 4 years. And we've actually used their antioxidant scanner in our practice just to help understand more about people's levels of healthfulness. What I've liked about it is that my gut is cool with it, right? I remember taking in dental school, like trying to take the Costco multis and, I mean, I would feel literally sick after eating them. And I'm like, well, that can't be good, So anyway, I've appreciated those.
Yeah, definitely good multi. D3K2. I generally will do like a morning smoothie where I'll toss in, my cod liver oil, some vitamin C, and then I do like a low and slow in this guy, magnesium, and then some form of electrolyte. So
Nice.
Just trying to take in smaller amounts throughout the day with meals.
True.
But, we've been fortunate.
Making an effort.
Yeah, exactly.
Yeah, I got my bottle.
Yeah. But we're fortunate to work with a lot of really great people who have done years of research and muscle testing on patients to find really solid brands and solid companies with which, we now work and that we've taken on for ourselves and, figuring out how to implement that for our patients as well, because it is so important.
Mm-hmm. Yeah, that's super cool that you guys are implementing the supplements, because I do believe that we just, in this day and age, we don't get all the nutrition that we need to from our food anymore. So supplementing with what you need when you need it is really important, super valuable.
So true. And to kind of add to that, the amount of stuff that we're exposed to that stresses our systems is, we are light years away from where we were like 50 years ago, with all the chemistry that's out there, the physical stress, the less in sleep, EMF, screen time. Like there's a lot of stuff that we have to try and counterbalance too. And, I have a garden at home, but I know I'm not going to cut it, at the end of the day if I don't add a little bit extra in. So.
Yeah, totally. I know sometimes people ask me why we're so sick. I was like, it's because we live in 2019.
Yeah.
Like that's why we're so sick. And you have to do so many freaking things every single day to just stay ahead of the ball game.
Totally.
Yeah. Okay, guys. Well, so first question I want to ask, what is the big difference between a conventional dentist and a biological or holistic dentist like yourselves?
So that's a great question. Excuse me. What I would share is that it's not as much about titles as it is mindset, but we have to have a way to differentiate from a marketing perspective, like how does our practice think, right? So 15, 20 years ago when I was first in practice, the term du jour was minimally invasive, right? In the last 10 years, holistic, biological has become more of the term du jour, but it generally refers to a dentist and his or her team who have a mindset where they're looking at the wholeness of the patient, not just at, oh, gee, do you have inflammation in your gums and, can I cut away at it? Or you have a hole in the tooth and can I drill it and fill it, right? Like, we've really worked hard to get a better understanding of why are these things happening for you? Is it stress in your life? Is it nutritional issues? Is it what's in your teeth? Is it meaning kind of iatrogenic? Is it dental work you've had done in the past that's making you sick? So when you look at, hopefully for most practices that would claim to operate from a holistic and or functional modality, they're actually looking at the whole health of the patient. Now, certainly it's possible to just join a group and slap a name on your website and say we're holistic, and maybe that doesn't mean anything. So I think that that should be, if you're reading that about a practice and you're seeking one, hopefully that's being supported in the reviews that you're reading online. We actually ask our patients to please tell your story. If you're writing a review, which we always appreciate, please tell your story, because we find it really connects with people.
Yeah, I would agree with that. And I think a lot of modern medicine these days, everything is so compartmentalized and divided, and that's how a specialist is trained. A cardiologist looks at your cardiovascular system, an oncologist looks at the cancer that you have, a dentist looks at your teeth, but all of those people are limited by the parameters of that body part, when in reality, when we're exhibiting signs and symptoms, it is simply that. It is not, well, you have a hole in your tooth, let's fill it. It's like, how did it get there? Let's figure out what's going on with your body chemistry. Tell me about your diet. Tell me about your diet 10 years ago. Like, there's so much information to be learned from a person. You just have to be willing to ask those questions and understand, like, you don't always have all the answers, but when you have the mindset to keep digging, you certainly have a better chance of finding them.
Oh, that's so cool. Super side note, I just made my first appointment to go see a holistic dentist, and it was like 2 months of a waiting list, and I'm just so stoked to have that appointment. Yeah. I'm excited to be talking to you guys today. You're making me even more excited to get there.
Good way to invest in yourself. That's so awesome.
Yeah, I'm super excited. So really fascinating. I mean, Casey and I, as nutritional therapy practitioners, and I'm also a certified functional medicine practitioner, we know the body is one organ, right? You got to look at all the pieces, but you got to look at the whole. So the one thing I wanted to ask you guys, because I know in your bio that we read, you guys talked about utilizing your knowledge of how all of the oral tissues are connected to the rest of the body. So can you guys talk about, I'm not a dentist, but it's the Meridian Tooth Chart that kind of shows how like every tooth is connected like different organs in your system. Can you guys talk about that and how all those organs are connected and how that system works?
Sure. I can start with that. Yeah. I know you'll have even more to input. So let's just consider the obvious, right? Even if you're a person or even a healthcare practitioner who doesn't necessarily espouse to follow this kind of a mindset, we would all agree we have blood that flows through the teeth, right? We have nerves that are in the teeth. We even have lymphatic vessels that are within the teeth that help clean things up. Most people might have experienced, if they ever had a filling, they may have experienced some tenderness in a tooth, and it resolves, right? We're pretty used to, we can experience inflammation. Our bodies are dynamic. They know how to manage that, right? So it takes fresh blood flow going in and out of that tooth to manage that process, right? So it would make sense that if something happens to that tooth, let's say the tooth becomes infected, and I know we talked a little bit earlier about this concept of like killing a tooth, mummifying it, and keeping it in your mouth, understanding that the entire second layer of the tooth is porous like a sponge, like that's not going to lead to health. So you have a sponge that's soaked up with anaerobic bacteria, and you have a lymph system in the bone that now has to drain that as long as that tooth is in your head. So then the question becomes like, well, energetically, what happens with that? Mm-hmm. What happens from the lymph drainage? Where does lymph go? Right? I mean, directly straight back into the cardiovascular system. So these areas of chronic infection, whether it's gum inflammation, so I mean, it's a lot of what you're managing. Yeah. Inflammation within the bone. That's all significant stuff. And I think that one thing to consider as well is, and you'll read these in our reviews and such, is, and also in our Instagram post as of late, is how people's lives change once they remove these barriers to health, mm-hmm. right? I mean, we see people every single day that travel from, as little as a building away to hundreds of miles away, who want to understand, like they've gone to their naturopath, they've gone to their chiropractor, they've gone to their physician, they've gone to their nutritional therapist, and like they're doing everything they can and they're still sick, right? And we might do an assessment and see like, wow, turns out you've got 3 root canals all in molars, and you've got problems with diabetes and thyroid conditions, and turns out those are all on those energy meridians. I mean, it's a little too convenient, I think, to say, well, that's just coincidence, right? But the real proof is in the pudding. When you get those teeth out, you remove the infection within the bone, you help the bone to heal, and then the patient's life literally changes. I mean, we will hear, gosh.
I just always go back to that one gal who was a massage therapist, and this was right when we were making our shift into kind of realizing, like, this is a really significant discovery as far as people's overall health goes. And she came in with what to her seemed like 2 unrelated issues. She had a tooth on fire, which is something we were going to help her manage. But, in talking to her, she was a massage therapist who worked on a cruise ship. And she had to stop working because her shoulder was in so much pain. She couldn't do it anymore. And these were, happening around the same time, but again, not drawing any connections. So, we ended up taking the tooth out and, managing the bone health and everything healed, and her shoulder pain went away. She got back to work. And that tooth was on the energy meridian for that same unilateral, on the shoulder. And so, I mean, these are things that we can't ignore. And like Dr. Blodgett was saying, like, to me, everything has to do with how a person feels. And they're also their best reporters for, what it is that they're experiencing within their own bodies and minds and systems. Mm-hmm. And so when they come to us saying, gosh, hey, I got this root canal and then I started to get this horrible issue in my ankle on the same side. Do you think they could be related? I mean, who am I to say yes or no? If you're telling me, within that same time frame, those 2 things happened, and then once we treat whatever issue it is, whether it's, cleaning up infection or, restoring balance to the oral tissues, and that symptom goes away, the body is just a system of really, really beautiful connections, and it will tell you when something's not right. And so we can't ignore any of those red flags. Mm-hmm. And we also can't assume that they're unrelated. We just know too much.
Yeah. Mm-hmm. One other thing I'll throw in there too, because it's easy for me to go to things like infection because they're so glaringly obvious. Mm-hmm. But I think one of the things that in our realm of work that happens so frequently and there's just no attention paid to it is, let's say you go in, it could be as simple as, you have deep grooves in your teeth and they're starting to break down, and your dentist is going to thoughtfully and conservatively clean those up and, put some fillings in for you, right? Helps protect the tooth. Let's say that's all better, but your bite's off. Mm-hmm. And for whatever reason, it's not obvious to you, but when you're sleeping at night, your teeth are trying to wear themselves down, right, by clenching. And it's not just a tooth thing at that point, right? All that force is going through your TMJ and creating inflammation in the ear canals and such that are just behind it. So, I mean, I've seen patients over the years where their chief complaint of their health is chronic vertigo and tinnitus, right? And they're like, God, I had to quit working because I can't, I'm dizzy all the time and I feel sick and my ears are ringing. Well, we get them some help in terms of modifying how their jaws function together, and miraculously, it all goes away. And it's like, maybe that had more to do with the fact that all my back teeth had been crowned and my bite was so off. You create balance in that system, and the body just takes care of the rest, right? Mm-hmm. So there's a lot that can happen within the walls of your dental office that can throw things off, and you may not be aware of how it's affecting you. I mean, there's a lot of things to consider.
Mm-hmm. Totally.
And of course, usually if you go see a dentist and gosh, we did this, it's hurting. Well, let's kill the tooth, right? Must need a root canal.
Yeah.
Yeah.
The famous word most people hear when they go to their dentist, right? So yeah, talk to us more about root canals and their negative effects on health.
Oh yeah. Wow. Well, I'm sure we'll both chime in on this deeply, but I'm crazy passionate about it. And quite honestly, I mean, my awareness of this being such a significant issue did not occur until well after dental school, right? I mean, I went to a great dental school, wonderful education. And this is just part of what we were taught. Like, if a tooth hurts, just take out the nerve, right? Fill it in with this stuff, right? You're going to seal it up. And it took me probably somewhere between 10 to 15 years to really see, like every time I was extracting a root canal tooth, that there was blackness inside the root system, and I guess for a while I just figured, well, that's just what it is. We just see things and don't question it, right? But then I'm like, wait a minute now, every time we do a root canal, when you seal it up, it's not black inside, right? It's tooth colored, right? And you're putting this pink filling stuff inside. So where's the black come from? And assuming when you take the crown off, there's no black inside the crown, where'd that come from? And that's when I started, thinking like, okay, wait a minute now. The dentin of the tooth is all just a series of canals, and the bacteria that live around that system are 5 to 10% the size of each canal, right? So it's no problem it's like taking your car through a tunnel. So once there's no blood supply or lymphatic defense against this stuff, it just fills it up. So then we came across a lab that would do analyses of roots, like from a DNA perspective, and we started finding out what's inside these teeth. And it's a mess. I mean, everyone I have sent, it's just, I mean, the list, tooth to tooth might be a few more things than others, but they're a long list and it's all toxic, right? And that's just the work that I've personally done. I know there are other practitioners who've been doing this for many more years whose evidence is just as conclusive. It's a toxic load on your body.
Mm-hmm. Are you guys talking about like bacteria and parasites and heavy metals and everything, or?
All of it's going to affect you. It really depends on, let's say it's a dead tooth and it has a small filling, right? And let's say you've had a root canal on that tooth. So we're trying to rule out that there's any metallurgical issues, right? Well, the toxic load of the bacteria in that tooth is going to be bad enough, right? But what we see a lot are situations where the tooth is dead, there's mercury filling that's been used as the buildup, because you got to shove the tooth full of something, and then they put a porcelain fused to metal crown on top of that and create a battery. You got dissimilar metals in connection sitting in a bath of saliva, and depending on the patient and their health status,
vitality.
Yeah, exactly. We may see symptoms look differently from person to person, but it's shocking. I mean, we have more stories than we have time, today to share, really, of people, and some of whom I've known for years, that I just didn't have an appreciation or an understanding for how much what had been built in their mouth was negatively affecting them until we took it apart. and put back in more biologically compatible materials, and or remove dead things, so their body could heal itself. And the response is always amazing. The body's amazing, right?
Yeah, it's a magnificent tool to heal itself. You just gotta give it the ability to do so.
Truthfully, yes.
And I think playing off of what you said, like, I like concepts that are simple and that make sense. And so when we first started to kind of become enlightened with how these connections were being created between really, really sick people who couldn't find, I mean, they go to all their doctors, we can't find anything, when they come to us. And because of this awareness that we have, we can finally eliminate another piece of that puzzle that's causing their illness. But one of my favorite questions to ask people is, and if you can answer this and give me an answer, I'll give you a prize, but what other medical procedure in all of medicine do you intentionally keep a body part that's dead? I mean, I can't think of one. And so I feel like as medical or healthcare practitioners or whatever you want to call us, like, we have a responsibility, if we want to progress, to question the things that we've done previously. That comes with accepting, the notion that, hey, at 5 years ago, this is all we knew. And fortunately, because we have a commitment to continuing to educate ourselves, we now know something that's going to be a more healthful option for you. But, to dig your feet into the dirt and say, well, this is how we learned to do it, and this is the way it's always been done, and to not question it. I think it's a huge fallacy in logic, and that's how we function here. I know that next year we will be doing something different than we did this year, and I can count on that because that's our responsibility.
Yeah, there's always so much new information out there, and health is just always ever changing on what we're doing to take care of ourselves.
Sure, and it's not linear either. Like, the concept of health is never linear, and you're never arrived. It's about educating yourself and improving and eliminating roadblocks, and that's a very cyclical, thing that we'll go throughout our lives.
Yeah, it's definitely a journey. Now, what about root canals and the possible connection to Lyme disease?
Yeah. So, what I can't help but hear that question and think about so many of the patients that I've met, right? And I've observed over, 20, 25 years of being in the oral health care field, there are themes, right? It's like, well, when somebody's sick or they're unwell, they're lacking energy, they're lacking vitality, and we don't know why, usually you're going to get a name that makes no sense, like idiopathic something, meaning we don't know, or, we might give it a chronic fatigue, right? Which it's a great way to describe symptoms, right? So, Lyme, like traditional Lyme disease, and I will qualify this by saying, like, I'm no expert in Lyme disease, but I have a great appreciation for physiology and infectious diseases, because that's what we deal with a ton. So, if you're chronically infected, you have malaise, you have lack of energy, and we don't know why. And you never had classical signs of, I was bit by a tick, I had a bullseye lesion, I can take it right back to that. You just went from feeling great to feeling not great. You may have an awareness that, and some of our patients do, that I was doing great, I had this kind of a job, or I was running my own business, or I was doing this, and my tooth started to hurt. I went in, I had a root canal, and over the next year, my health just, and it's generally far enough away in terms of the onset that it's not obvious, right? But you take the tooth out and suddenly their health returns, right? It's not always the case. But so what's interesting is that, and I keep looking in PubMed with the time that I have, which, you gotta stay up late, right? That's why my sleep is not my strong suit.
There you go.
But, more and more information is coming out tying together chronic infection, right? Which is, there's been a lot of press, so to speak, or attention given to cardiovascular health and the risk of infection within gum tissue, right? Or even the latest one was Alzheimer's. Chronic infection in the mouth, showing connections, even with so far as to say causation between periodontal disease and heart attacks and strokes. So let's say you have a relatively healthy periodontal situation, but you have dead teeth, right? Even the healthiest of periodontal patients are going to ultimately have an infected root canal. But the rate at which they absorb those bacteria might be much, much slower. They may get more life, it's an ironic term, out of a dead tooth, or more functionality out of the dead tooth if their periodontal health is better, right? Just because they're not bathing it in a bath of grossness as much. But, sorry, I got a little off topic, but.
It's all good. So are you guys seeing like spirochetes in the gums? Because typically spirochete is a Lyme bacteria.
So I think, going back to your question, again, I'm not as familiar as I'm sure other practitioners are, but to know what we can culture from, say, like a removed root canal, the types of bacteria that are in there, certainly spirochetes are one of them. And so if we're looking for a source of some kind of infective biofilm, it can absolutely be one. Cavitations is another one. Even, like Dr. Blodgett was saying, like periodontal infections, so infections of the gum tissue, depending on whatever's growing there and assuredly leaching into your bloodstream. You go in for a blood test for Lyme's and you're testing positive for the presence of spirochetes, like absolutely, right? But I think the notion that he was trying to hit home is, again, it's a diagnosis, which is good in a certain sense because we're trying to define something, but also sometimes by defining them, we're giving people a stamp of like, this is your fate, you have Lyme's now, and it's something you're gonna have to battle your whole life, versus like, okay, let's look for places that we know could be harboring this type of bacteria, or what do we know about chronic infections? They make you tired. Like I had the flu 2 weeks ago, which is a very acute issue, but I was in bed for a week, So imagine somebody with a very low grade infection whose immune system is constantly 24/7 managing it so that they don't die. It's a really tiring thing. So yes, certainly I think you can connect the two. Just like, I think a while back there was actually a picture I remember seeing at a meeting we had regarding the connection with specific spirochetes. In this case, we're talking about periodontal infection and Alzheimer's, because they can have affinities for fatty tissues. They look like little corkscrews. And then they're taking these shots of neurons where they're then being infected by the same spirochetes. So, we have to we live in a world of bacteria. We're more bacterial cells than we are human cells, but we have to figure out a way to live with them and work with them and not, create environments that are conducive to the overgrowth or hiding, of these bugs, which anaerobic sites like root canals or cavitations or below the gum line are their prime areas for those things.
Yeah. Well, one other thing I wanted to add to what you said, which I really liked, Mara, was, this notion of we're going to give you a diagnosis, right? You have this, and then it becomes like an identity rather than asking the question, okay, if we have that infection, from where did the bacteria come? You weren't born with that. So, and unfortunately, we do a fair amount of outreach in the extra time that we have to try to connect with other, people such as yourself, nutritional therapists, naturopaths. I've tried with MDs. I'm sure there are some that are open. I've not had as much luck with that. But we're trying to shine a light on this fact that, a lot goes on in here. We see it on a daily basis, but having been a dental student who then went into a hospital-based residency for a year, I recognized very quickly that medical doctors get trained on everything in the body except right here. It's just the craziest thing, and it's not their fault. It's just not part of the educational process, right? So, you know, it's the weirdest thing. It's one of the first things we expose our bodies to. You know, we taste things.
Breathe through it.
Yeah, it's like the air and the food
Yeah.
and the water. It's all coming through the mouth. And, you know, hey, when it comes to our health, let's focus more on, you know, other things that just make so little sense.
Mm-hmm. Yeah, it's so true. I mean, your oral health, I feel like, is the gateway to like all of your other health, you know? And like, if you ever have a conversation with someone and you can just kind of see like, oh, your teeth don't look super healthy or something's going on. I mean, for me as a, you know, functional medicine nutritionist, I'm always like, what's going on in your gut, you know?
This is the beginning of your gut. So, you know.
Yeah.
Absolutely. Absolutely.
Yeah, that's wild. Now, I had a friend, because I want to talk about cavitation. So I had a friend who had his wisdom teeth taken out. Long story short, like blood pressure was a mess, dizziness, lots of other fatigue, crazy symptoms that were unexplainable. So long story short, he went and did the full, I think it's called like a CT scan, like the full mouth x-ray.
Yeah.
And had the infected wisdom teeth sites, right? So he went and saw a biological dentist and had a cavitation done, and they did find spirochetes in his gum. So he was super nervous about, you know, Lyme, because he had never been diagnosed with Lyme, didn't think he had it, didn't really have any of the symptoms, wasn't, you know, that down as typical Lyme patients can get. But so, yeah, talk to us about cavitations, like what they are, how people get them, what you can do about them.
Sure.
Yeah.
It's, well, so the simple version is, imagine like most wisdom teeth, not all, but most wisdom teeth are taken out on people who are in their late teens, maybe early 20s. We see a lot of, well, gee, I'm getting off of mom and dad's insurance. You know, I better run in and get my wisdom teeth taken out. Not really thinking about, well, would there be a purpose for them being in your mouth in the first place? But that's a totally different conversation.
Yeah.
So you get these things out, right? And particularly, depends on their angulation and such, but these are tricky areas, okay? It's particularly the lowers, it's dense bone. You have to have great blood flow into the area for new tissue to form. Teens are not necessarily known for phenomenal diets or following instructions wonderfully. I have 2 teenage daughters, so I can relate to this. So, you think about that, like, how do you then, if you got a blood clot in there and you go eat your Cheetos, and something goes jabbing into this and suddenly it starts to break down, which they do frequently, your gums are going to heal over that space a lot faster than the bone underneath, right? The bone takes months, whereas the gum just takes a few weeks. So if you have infectious bacteria, food particles, who knows what, right? Trapped down in there and the gums close over the top, your body's smart, right? It's going to start walling it off and do its best to contain it. But if you have foreign material inside of bone space, that's going to be just like a root canal. It's going to be a chronic area of irritation, infection, inflammation, right?
Mm-hmm.
Now, for many people, you're going to be dealing with lymphatic issues, energy issues, nerve issues, because they're usually, not all, but most lower wisdom teeth in particular are right next to your inferior alveolar nerve. It's like, think of a big electrical line that plugs into all your teeth and your lip, right? So, I've had patients who've had chronic numbness that dissipated, after 40 years when we clean up their cavitation, fill it with their own cells of LPRF, which is just, we do a blood draw, spin it out, put their healing cells back in there and let it heal. And their numb, their feeling comes back after 40 years. And it would make sense in any other part of our body. If we left foreign material, left it infected, it's going to be telling us all the time, something's not right here. And of course, we would run to the doctor immediately. But in the mouth, we go, I don't see anything obvious. And you made a really good point, Megan, about the 3D cone beam CT scans. So, when we were in school, and for, maybe the first 5 to 10 years of my practice, we only had 2-dimensional radiography. So if you're shooting through, material this big and flattening it out like a pancake, and you're trying to make qualitative analyses of what is the bone like inside, where the density can vary a little bit, but you're having to shoot through a thick wall of bone on the cheek side and a thick wall of bone on the tongue side, it's probably not going to show that much. 3D radiography has completely changed what we are able to appreciate. We've had ours now for, actually this month it's a decade. No, sorry, 11 years. 11 years we've had 3D radiography in our practice. You cannot go back, right? And of course, there would have been really no effective way to appreciate cavitations. I mean, unless it was absolutely awful and so obvious on the x-ray. But you cannot compare the two, right? So it's a big deal. I'll be quite honest, when I first came across the concept, which was brought to us by a patient, asking, I'm like, gee, I've never heard of that. I'll have to do some research. And then, I read about what it was. I found a dentist who was doing courses on it, took the whole team, and we all went and learned about it. It was like, whoa, that's amazing, right? So, and then you start caring for patients. The first few that I did sampling of the material inside the site and had that blood and material analyzed, the DNA analyzed, and it's just all infection. And you shouldn't have infection inside your bone space, right? That should be a sterile area. But when we're scooping out gunk, you weren't born with that, right? So you have to be I think it is wise, at least, to be conscientious of how do you go about taking teeth out? How do you ask the body to heal that site? Because as compared to most surgeries, right? If you have brain surgery or knee surgery or whatever, you're opening a space that you then have the advantage of closing and stitching it up, right? A wisdom tooth, generally speaking, let's say the tooth is partially exposed, you're gonna have a hole there. You can't, there was something that took up that space, so you can't bring the tissue back over the top all the time. So that's at high risk for falling apart, getting infected, and or bringing with it foreign bodies into the bone space, right?
And isn't it pretty standard procedure, standard of care for a conventional dentist to leave? I think it's some type of membrane. So kind of like what you guys are talking about taking everything that would die, because it's not supposed to be in your system anyways. It's not supposed to be left in your body after they remove a tooth, but they leave a membrane, but then it just kind of sits in that site and rots, right?
Well, yeah, it's like what you're talking about is what's called the periodontal ligament.
Okay.
So it's a funny deal, right? You've got bone and you've got a tooth. And so you have to have some sort of attachment apparatus. So think of it like every tooth is suspended by these little ligaments, right? And they go in all different directions. And I mean, having taken out thousands of teeth, I'll tell you, sometimes you see those ligaments on the root. Sometimes you don't, right? Sometimes they're actually still attached to the bone. So your body's good at cleaning up minor things. You have cells, macrophages, for instance, that can go in like Pac-Man and eat stuff up and digest it. But if you're leaving behind an abundance of that, or you're leaving behind stuff that is still chronically infected, your body's going to try to encapsulate it, right? And it's going to be a constant source of irritation or infection.
Yeah, and I think that has to do with the technique awareness, right? I can't tell you how many people tell me about their wisdom tooth extraction story if they happened to be awake for it. And it's usually the guy's hand was on my forehead and he was yanking at the tooth. And so, what does that technique look like for them? Are they pulling it out and then just suturing it up? Or are they pulling it out and letting the blood clot and leaving it be, versus taking out a tooth intentionally in a way that's atraumatic, cleaning out any remaining sides of the bone, depending on, if it were a healthy tooth, like a vital wisdom tooth, versus a really infected one where we're already going to be going in and taking out all that bone anyways because it's necrotic. That has to do with the person's technique. But I think the thing about, wisdom teeth and cavitations that's really unique, like kind of going back to that, is when patients come in, what I'm listening for from them, because you can't say, oh, well, these are symptoms of a cavitation, because I've seen them all. I mean, the list is so wide. The array of symptoms that they present with could be anything from GI upset to chronic fatigue to pain to numbness. I mean, it's everywhere, right? Or my big toe hurts. Like that, listening to that and listening to the time frame within what their experience was. Like I had, like that, well, I can't remember that one gal's name, but who had her wisdom teeth taken out 40 years previous and never felt the same sense. And then as soon as the cavitation surgery is performed, it's like she's back to normal. But those, I mean, what you're looking at basically when they're removed, and this is what's so disgusting about them and why it's so important to be looking for them, is everyone cavitation that I've seen, I've watched them do a few surgeries. There is stuff coming out of there that you would not believe. I mean, there's this oily substance called saponification that looks super grody. I've seen green stuff. I've seen black bits. I mean, there are things there where the body's utilizing this place that's already just like a trash can, and it's dumping other things in there. I mean, I know with some of the things that we've learned in school, like they found, it's a heavy metal dumping ground, or it's a place that's harboring bacteria where they're having a heyday. I mean, they have nutrient sources, they have poor immune access because the tissue surrounding them is necrotic. So they're just nasty things to be dealing with.
That's wild.
Well, and just to add on to that, I've got to share this with you because we want to compare this to the traditional model of thinking, right? This poor lady with her who had this issue for 40 years, the approach that was taken after her wisdom tooth was taken out and she continued to have pain was, well, second molar looks kind of suspect. I think I think something's going wrong. Let's do a root canal. So they killed that tooth. Still having pain. Oh, you know what? I think it affected the tooth in front of it. First molar has a root canal. Still having pain. Ooh, so she ended up like her second molar, first molar, second premolar, and it might have been her first premolar, I'm not sure, all dead, right?
Wow.
So, I mean, it's just insult on top of injury, you know? And it's not that we can expect everybody, all health practitioners to know all things. By no means am I suggesting that, because I was not trained to look for these things in dental school. But also we didn't have the technology to visualize it, right? So, but I think that at the very least, approaching what our patients share with us, as we listen to their health story, that we approach it with, a lack of judgment, an open mind. We just know so little, right? So, it's the traditional modality is, well, just keep killing things until you don't feel anything, including the patient, right?
Yeah, it's crazy.
I mean,
So
that's
on
the
that,
health model.
on the topic of kind of traditional modalities, because something that I've been sitting here thinking, and I'm sure our listeners are going to be thinking this as well, let's say that they do have a root canal or they've had traditional fillings. What are some of their options to, I guess, like remedy it? Or do they, if they're not experiencing what they, how should they move forward? I guess would be the question.
That's such a powerful question, because there's no black and white answer, obviously. It really depends on at what level of health and health risk are you willing to live, right? So, because it comes at a cost. Once a tooth has had a root canal, I mean, it's effectively now disconnected from your body being a live functioning organ. It's no longer connected. However, and I appreciate this, it is serving a functional purpose, right? So, it's like, let's say we do a 3D scan and we don't observe that the bone is responding overtly to this dead tooth yet. And they will, but let's say it hasn't yet. We oftentimes get the question of, well, is it okay? And all I can say is that, well, I've sent out dozens of dead teeth for bacterial analysis. I've never had one come back that wasn't ridiculously infected, whether they were symptomatic or not symptomatic. Okay, so the choice ultimately boils down to you. Do you feel that you're willing to tolerate the risk that it poses to your health to maintain this dead body part? And if they say, yeah, I think I am, well, that's fine. Let's talk about how we can help your body to fight this as well as it can. And that might come to nutritional, that's where we would make referrals to nutritional therapists to say, this person's going to need help, right? And we also leave them with the expectation that we will, we'll talk about this again. It will become an issue. I mean, I've certainly seen this in the family members that I've had the advantage of caring for over the years, where I've watched root canals that have been in their mouth, let's say for 20, 25 years, right? And now we're at 45, 50 years. And because like in one case, their periodontal health is immaculate. And so it's taken a long time for their root canals to get to a level of infection that the bone says, okay, no more, right? For other people, it's like, well, we did this root canal, and within 5 years, the body's not tolerating it, and the rest of their systemic health is not so good. And, it's like, well, how does a sick body maintain a dead body part, right? So, yeah, it's not black and white. From the perspective of what do we do. However, I would say that because of the nature of our practice, most of the people that are seeking us are wanting the infection out. They're wanting the least effective, or what's the word I should use? Like, how would we describe zirconia implants?
Like a more benign material, like a material that's not interactive, really.
That's probably the best way to look at it, right? Because zirconia implants are, it's an oxidized metal. Happens to be tooth colored, which is helpful to us, but they tend to not have the issue of ions being leached into the body like you do with titanium implants. Now, if titanium was my only option, which it has been for years and years and years, it might be better to have that tooth than not. Depends on your sensitivity to metals, right? Which is yet another thing. So to get back to your question about what do we do, right? Well, we have these conversations from kind of a global health perspective. And again, because of the nature of our practice, most people are already showing up and saying, I've talked to my dentist and 2 others, and they all think I'm crazy to take out my root canals, but I have felt horrible ever since I had them, or the tooth never felt right. I can tell you as a dentist who used to do root canals fairly frequently, it's not fun management, They all end up having problems eventually, right? So either if it's successful, maybe I retire before it becomes symptomatic, but that certainly has not been the case with some frequency. So we spend a lot of time talking about how do we help your body to grow healthy bone again. What kind of time frames do we generally allow to let the bone and gum tissue heal? And then what are our options for tooth replacements? Are we okay with something that's removable? That's an option. I'm okay with that. Are we considering a bridge, which, when I was getting out of dental school was still somewhat common. Nowadays, implants are just, they're so predictable if we get healthy bone, that for a lot of people, especially now with zirconia, most people go with implants, but it's also an investment, we have to consider that. So yeah, those are kind of the conversations that I would say we have.
And the same conversations for, removal of toxic materials. So mercury fillings, again, a lot of people are coming to us for that because we are SMART certified. So we can safely remove mercury, which is good for them, but also for us. But, we also have patients for whom that's not a priority, and maybe it will be one day, but, for the vast majority of people that are coming to us because they're working with somebody, they're working on their detox organs or GI health, and you can't properly go through any kind of cleansing of the body if you're having that source of heavy metals dumping it into the system still. So, but again, I think the main point is, we have options. We want to work with people and meet them where they're at and help them achieve their goals, whatever that looks like. It's a really, like, there is no cookie cutter answer, and there's no, repeatable treatment plan for anybody.
Mm-hmm.
Right.
That's the fun part.
Right. Now, in terms of, prevention and just taking good care, like good oral care, what do you guys recommend? Like, should we be using a Sonicare? Is a standard device of flossing? Like, are all of these still applicable?
I'm gonna let Mara take most of that, but I want to start with this, that like gut health first, you know, like, I mean, goodness gracious, if people's lifestyle choices are such that their body is not receiving the nutrients and rest and water for that matter, if we're being honest, their mouth will tell us that story.
Mm-hmm.
If we're, it's always there. It's whether or not we have the ability to understand and appreciate what the tongue, what the gums, what the teeth are telling us. And I'll throw a pitch in for the book Dental Diet. Great book. Our whole team read it over Christmas. Wonderful book to help even lay people appreciate the power and impact that our diet has for our oral health. But with respect to other, what are your thoughts on that?
I totally agree. I mean, every person's, unique, and you have to, again, because we're a holistic practice, I don't talk to people about like, well, you're gonna need to brush and floss twice a day, and if you don't, you're gonna get cavities. Like, that's so far off from where we're at. How is your gut functioning? How are you doing? What are your stress levels like? How much sleep are you getting? How much water are you getting? Like, it's starting with the basics, because people have a hierarchy of needs, and if the bottom ones aren't being met, I'm not even gonna go into that stuff. We have to meet people where they're at within, like you said, their health journey, within their life, So I think that's the place to start with people. Do I like electric toothbrushes and flossing? Totally. They're really easy and predictable for most people when they're using them properly. But oral health and keeping teeth clean has so little to do with the bigger picture. Like Dr. Blodgett was saying, when I'm looking at people's mouths and seeing, what are their buildup levels like and their inflammatory levels like, and are there toxic materials present, and is there a hidden infection present? Those things have very little to do with, well, I'm brushing twice a day or I'm flossing once a day. It has way more to do with this being kind of a sign or a window to the rest of the body's system. Now, certainly if people have a ton of overgrowth of biofilm on their teeth, that's not only going to affect their teeth, it'll affect their GI health, it'll affect their cardiovascular system. And so it's more about doing a really thorough assessment of each person. Diets included in that, nutritional intakes included in that, and then kind of going from there. So it's hard for me to really speak to any absolutes for any one person, because like I said, I mean, if we have a patient whose husband just died, am I going to go harp on them about brushing their teeth? No, we're going to talk about how we can get some of their more important needs met first, and be there for them and support them as part of their health team.
Mm-hmm. Mm-hmm.
Yeah, I was thinking as Mara was stating that, she's so articulate, I appreciate it. I was thinking about the concept of balance.
Mm-hmm.
So one of the struggles, I recall like meeting with a patient years ago, right? And it was kind of beautifully ironic that her father was a dentist. And one of the things that we do in terms of understanding risk for decay is we will swab teeth, mix it with some enzymes, and put it in a light meter so we can get a sense for how frequently is your mouth being exposed to an acidic environment, right? And it took me a while to ask all the right questions to get down to like, why is this gal's number so high? And she's like, because she brushes 3 times a day, she flosses like dad taught her and all this stuff, but she was sipping on kombucha like all day, right? It, like literally, she's like, well, I've got it in the car actually. It's just I open the top and I take a sip and I screw it and put it in there, and then have another sip a half an hour later. So one of the things that we deal with from an oral health management standpoint isn't so much like, are you brushing the right way or flossing the right way? It's like, how are you eating, right? So if I think back to my days in high school, we didn't have plastic bottles with screw tops, right? It was, if you had a Coke, it was a can, you cracked it open, and you were going to either drink it all yourself or share it with friends before class, because you can't take an open can of Coke into class, right? So nowadays, it's all, we got our screw top bottles, which I think is great when you're carrying your own bottle where you've got water and such. But the stuff at the Quickie Marts or whatever you're getting, like, it could even be carbonated water for that matter, where they add stabilizer, shelf life stabilizers for the flavoring and all that. And it's acidic. The pH is 5.5 or worse, and that's going to break your teeth down, right? Your teeth are just these dense mineralized organs, and if they sit in acid long enough, they melt, right? So I think that's probably one of the biggest take-homes we try to give people is how you choose to eat and drink. It is so much more impactful than how am I brushing twice a day, right? You might spend 2 minutes brushing, but you could spend 10 hours sipping on your insulated
apple cider vinegar.
Yeah, exactly. I heard lemon water was great, so I've sipped on it for 12 hours a day. It's like, oh boy, there is, and that brings me back to the balance point. It's like, well, maybe a little acid in your gut would be really helpful, but not at the cost of your teeth, right? You don't. You need acid when you want to digest, not all day long.
Yep.
So these are just our day-to-day conversations.
Yeah.
My mind is so blown right now. Just FYI.
That's great. Well, and I will say, also having utilized, I remember as a kid getting our first electric toothbrush. My parents, this was like 35 years ago, and thinking of the things that we have to utilize now, like you were just saying, Mara, they do make it easier.
Totally.
I mean, I love the what is it, the Philips one that I use now?
The Oral-B.
Oh yeah. It's awesome. Love that thing. But that being said, I also use a manual. Like I kind of alternate. It's like you do different workouts at the gym. I like having variety.
That's cool.
Yeah.
I didn't even think about that.
I know, me neither.
I just use the good old manual one still.
Which is totally fine.
It totally works.
I have people who use those and everything looks great. And we're like, fantastic. I have people who use an electric toothbrush. I'm like, you have to put it on the teeth, right? So everything's a little bit different for each person.
Well, when you think about it too, I like analogies. So if you imagine all right, I'm going to go out and wash my car today. You might love the old mitt, the sheep's wool mitt, and you like doing it by hand and getting all the nooks and crannies, and that's great. And somebody else might like the Power Washer 3000 that's got the rotary brush on it, and they do it that way. At the end of the day, they both create clean cars. So, whatever works for you.
Yep. I love it. I love this conversation because it sounds like a lot of things that I think Casey and I talk to about our clients with all day, It's just, what are you eating? What are your stress levels? How are you sleeping? Are you blocking the blue light before you go to bed? Are you getting sunshine when you wake up?
People would be amazed, I think, if they just started with 5 things, right? Sleep, water, look at your nutrition, maybe cut out some of the sugar you've been eating, think better about yourself.
And turn off your screens.
I mean, you would be amazed. Those are the simplest things, and you can have beautiful health results from it. But it's about, you have to ask the question, right? I mean, and that's where we start.
Yeah, that's fascinating. And now, are you guys doing protocol creation after your procedures in terms of supplements or IV therapies or ozone, that kind of stuff?
We're starting into that. We're starting to kind of meld into it. I mean, there's certainly some baseline nutritionals, I think, that are really, really helpful, not just for healing, right, but just for health in general. So a high potency vitamin C, D3K2, a good multi, red light therapy, which has been amazing for increasing healing time. Some people, will do some concurrent ozone, for instance, people who have had root canals on their upper teeth and they blow out infection into the sinus, and now we're trying to manage a sinus infection directly, then maybe some repeat ozone therapy to address that. So, I mean, again, it's such a unique, patient-based, scenario-based prescription, if you want to call it that, but it's something that we're now just kind of delving into, I think, and learning a lot more about.
Yeah, absolutely. I mean, and Mara said like earlier on in our conversation how, the things that she's passionately excited about is that knowing, next year, the year after that, we're always going to be growing and learning because of the ethos of our practice is to always be growing and learning. And one of the things I've loved since we started offering red light therapy, I mean, we actually send patients home with red light units, have them use it for 2 weeks and bring it back at their post-op check. And I mean, it has improved healing vastly. But what I was going to say is that they're so open now to having input about like, I would suggest taking these things nutritionally to help your body heal. I actually love the D3K2 sublingual spray, because even somebody who's
post-surgery. And
like it's tough when you're you don't want to eat stuff, you don't want to swallow pills, that you're recovering from oral surgery. Anybody can lift their tongue and do a little spray, right? So that's pretty awesome.
Now, what kind of red light are you guys using? Is it like a Juve?
Good question. We're not currently using Juve, and if I'm being totally honest, it's because of a price point issue, right? They're not cheap, and it would be tough for us to send out units. But I've been using
MedLight.
Oh yeah, it's called MedLight.
Okay.
So we've bought a number of units, and we also offer them to patients if they want to buy them. And I think we have maybe a dozen in circulation now, which we just started doing this about 3 months ago, and it's great. I mean, I've got one at home. Most of the team members have bought one and taken it home. But we also, since we have like very powerful lasers as well that we use clinically that have different hand pieces where we can do photobiomodulation. So at the end of most visits now, patient's been open for a while, their TMJ sore, whatever. We'll use the low-level laser therapy handpiece and just cover, this side of the face and then this side of the face, and do, maybe 3,000 joules or so of energy each side with, we're using like 630 nanometer red light and 810 nanometer infrared light. People love it, instantly decreasing inflammation using light. So much more effective than like, here, take your ibuprofen, I mean, does ibuprofen work? Sure. Is there a way to get the same result less invasively? Yeah, right? So people have been loving that. But
they're also getting a nice anti-aging treatment too.
Right? But I will say the Juve and other similar products, I think, are phenomenal. And I just think that I wish more people had awareness of that. I got into doing low-level laser therapy. I'm still stuck on the old term, right? Maybe 15 years ago. And I just, a couple months ago, read Ari Witten's book, Red Light Therapy. And he does a beautiful job of sharing like the latest scientific evidence behind how it works on a cellular level, how it's rejuvenating to like from an anti-aging standpoint. And these are so cost-effective. Good stuff.
Very cool. Well, out of respect for your time, I know we might have to have you guys on again because we still have a lot more questions on our Google Doc here that we did not get to. And we have to rant about root cause not being on Netflix.
Oh, that's right.
But thank you guys so much for being on the show. We had a great time, and I know I learned so much, and I'm sure our listeners are going to learn a ton as well.
Thank you.
Thank you so much.
Thank you guys so much. Really appreciate your time.
Of course.
All right.